It gives me great pleasure now to bring on board Mr. Pratit Samdani, critical care expert, doctor of Breachkandi Hospital. Dr. Samdani, this is the first time I'm interacting with you, so it's an absolute pleasure to have you on ET Now. Dr. Samdani, things are not looking up. Things, in fact, are, I won't use the word they're getting bad to worse, but things certainly are not looking up. Do you think implementing local and partial lockdown is a good solution?
Morning, thank you. So things are not looking good. That's pretty true. The numbers are clearly rising all across the country. And, we went into a lockdown very early, which is the correct strategy. We did open the lockdown because, it's a question of lives or livelihood. And we had to look at livelihood now, just not only lives. I think partial lockdowns, yes, in containment zones or hot zones should be the way to go ahead. At least 7, 10, 14 days rather than a long stretch of a month or 6 weeks should be the way to go to get these numbers down. Also, with the increased availability of testing now, we are getting more cases. And we always knew this, that for every one positive case in the past, there were at least 3 or 4 more lingering in the community which were not tested.
Should we expect a geometrical and exponential rise in Mumbai, because now you don't need a prescription to get yourself tested? BMC thankfully has relaxed rules.
So yes, finally, the bridge over the mind and the pen has come, and it's easier for doctors to prescribe and patients to go ahead, the citizens to go ahead and do the testing. If you see globally, United States as of July 8th is doing about 1.93 tests per 1,000. And India is lagging behind, and we're just doing 0.17. And of course, we must remember there's a geometrical difference between the population. If we see state-wise, Maharashtra is doing about 7,400 odd tests per million. And we've tested about 9 lakh individuals till now. And we have a positivity of about 18%, which is pretty high. I would say a positivity rate of anywhere from about 2 to 12% would be the ideal circumstance. And if you see the other side, Telangana, which also has large numbers, the test per million is dismal at 2,000 per million. And they've only done about 80,000 cases and 17% positivity rate. So I think with the increasing number of tests, we will have more positive patients. So the denominator of the whole fraction will increase. But let me tell you, being, treating patients in the last 4 months continuously, patients are not doing badly. They're faring pretty well. The number of admissions of patients requiring ICU in terms of morbidity and mortality has reduced. So there is some good news and there is some light at the end of the tunnel, but you would see a large number of positivity patients henceforth.
What is the good news you would like to share with our viewers? More and more realization is coming in that the mortality rate in India is better. Is it true, or this is just interpretation of data? The challenge, Dr. Samdani, with data is that politicians and administration will try to make it look better and the reality could be different. I want to hear a doctor's view.
Oh, so let me tell you my view, keeping aside the bureaucracy and politics and municipality away. As I reiterate, for every one positive patient, there's probably 3 or 4 more positive in the community. So if I tell you that we've had, say, 500,000 patients who are positive, I actually feel the numbers are much higher than 500,000. And the people who are dying, if you divide this, the percentage of death is very, very low compared to what we assume. So one, the fear of death should go away from patients. Of course, it's a disease, it's an infection. Every infection and disease in a normal day also causes mortality. So those individuals who are at high risk have to be more careful. The other thing is with more experience, getting to know the virus pathophysiology, we've been able to tailor and treat patients quicker. Awareness among citizens and, monitoring them at home has also easier. I would just, we're getting more patients now who are being treated at home than coming into hospital. It's a great thing, but the patient should not delay coming to the hospital if they have symptoms that are not that are worse than what they had before. So that's one red tagger that I would like to tell the patients. But yes, the mortality is less, morbidity is less, and more patients are becoming better. We are getting lesser patients who are getting more severe infections.
And closing comments. As someone who is practicing right now, is taking care of COVID patients in Breach Candy Hospital and various other hospitals, what's been your experience on all the claims which a lot of companies and governments are making that remdesivir and HCQ in a sense is helping? I mean, is there evidence? Is there evidence to believe that there is light at the end of the tunnel on the therapeutic front, and are these medicines really working, or these formulations really working?
See, as of now, or say about a week ago, we had no specific antiviral. So this is a virus, so you need an antiviral. With the advent of remdesivir and favipiravir being the oral one used for milder infections, and remdesivir being the intravenous one used for hospital care for more moderate to severe patients, I think there will be an improvement in terms of numbers of patients dying. So morbidity and mortality will decrease. It's not supposed to be a wonder drug. It cannot replace a vaccine, but certainly data from the past has shown us that it reduces the symptoms by a mean of about 3 days. So if you were to get okay within 11 days, it will reduce your symptoms and you'll become better in a mean of 8 or 8.5 days. However, there's been no data to show that it saves lives. But I think it's too early to make that bold statement. I think we will have data in future to say that it saves lives. The other drugs, hydroxychloroquine, unfortunately, hydroxychloroquine has now been proven worldwide that there is no beneficial effect in terms of treatment or prophylaxis. That's the data that we have from the West. I have my reservations for saying hydroxychloroquine does not work. I think we need a more local data. We are a different country. We are a different genomics. And I do feel that there may be some hope of hydroxychloroquine, but at this moment, there's no hope to say that you should use it as treatment or prophylaxis. The other drugs that we have are the interleukin-6 inhibitors. They are specific drugs that are used in patients who get into a cytokine storm or a form of disease which is more severe, typically occurring after a week to 11 days. And patients become breathless, and patients can have several multi-organ involvement. So we have drugs like interleukin-6 inhibitors, like tocilizumab, and now itolizumab, which has been approved by the DCGI 48 hours ago. These drugs help curb the cytokine storm, but I would be careful in using them, use them judiciously, and put them, as a patient-to-patient, rather than just use them blindly like an antiviral, which one would do. So we do have therapy. We have streamlined therapy. We give a lot of ancillary treatment to prevent thrombosis. We use low molecular heparin and oral anticoagulants. We use steroids in our severe patients, but they are tailored based. That's not a blanket treatment what one should give to everyone. So I think we should learn how to live with this virus. This virus is here to stay, unfortunately. And over a period of time, people will become more used to living with this virus. But the casual attitude of the citizens should not be taken just randomly. I mean, patients and people and citizens should be careful. I tell everyone you should do the big 5, wash your hands, cover your face, wear a mask, do not touch your face or mouth, and keep a physical distance. It's not social distance to me, it's physical distance, because keeping a social distance, creates a problem with the mental status, and we need to keep the sanity of the mind intact. So you should keep a physical distance. So please follow these norms, and I think we will beat this virus no sooner than later. Until we get a virus and say that, we have overcome this virus, it's still time. Or until we get a vaccine, it's still time. Until then, we have to fight together.
Dr. Samdani, it's been a pleasure having you on the show. Many thanks for joining in, and thank you for your relentless work day after day.